Hello friend, today we are discussing different types of coughs and remedies. Coughs can be categorized into different types based on their duration and underlying cause. 1. Acute cough. Lasts for less than 3 weeks and is often caused by viral respiratory infections like the common cold or flu. 2. Subacute cough. Lasts between 3 to 8 weeks and may be a lingering symptom of a previous respiratory infection or due to irritants like smoke or air pollution. 3. Chronic cough persists for 8 weeks or longer and can be caused by various underlying conditions such as asthma, allergies, gastroesophageal reflux disease GERD, chronic bronchitis, postnasal drip from sinusitis or allergies, smoking, or exposure to secondhand smoke, chronic obstructive pulmonary disease COPD, respiratory tract infections, environmental factors such as air pollution or occupational exposure to irritants. 4. Dry cough, a cough that does not produce mucus or phlegm, often associated with viral infections, allergies, asthma, or irritants like smoke or dust. 5. Wet or productive cough, produces mucus or phlegm and can be caused by respiratory infections, bronchitis, pneumonia, or chronic conditions like COPD. Here are a few home remedies for relieving a cough. 1. Stay hydrated. Drink plenty of fluids like water, herbal tea, or clear broths to help thin mucus. Tea, honey, and lemon. Mix honey with warm water or herbal tea and add a squeeze of lemon. Honey can soothe your throat, and lemon can help break up mucus. 3. Warm salt gargle. Gargling with warm salt water can help soothe a sore throat and reduce coughing. 4. Steam inhalation. Inhaling steam from a bowl of hot water or a hot shower can help loosen mucus and relieve congestion. 5. Humidifier. Using a humidifier in your room can add moisture to the air, which can help ease coughing caused by dry air. 6. Throat lozenges. Sucking on throat lozenges or hard candies can help soothe an irritated throat and reduce coughing. The cause of a cough can vary depending on factors such as age, underlying health conditions, environmental exposures, and lifestyle habits. Identifying the specific cause is crucial for proper treatment and management of the cough. If you're experiencing a persistent or severe cough, it's advisable to consult a healthcare professional for evaluation and diagnosis. I hope this video is informative for you. If your answer is yes, then please share this video and subscribe to my channel.